All right, now we're going to study the GI system, but before we get into the GI content, I want to talk to you a little bit about making room assignments. Making room assignments is a very important part of the NCLEX exam, so let's talk about that. And this is not on your handout, I'm just talking now, okay? Now, one thing that I want you to know is a basic rule for making room assignments, and here it is. Like illnesses can go together. Like illnesses can go together. Like illnesses can go together. All right? Now, what I'm going to do is take you through some examples now of how you would use that basic rule that we have. First of all, what if we had two patients that had the flu, and we could tell by reading the test question that they had the exact same type of flu? Would it be okay to put them in the same room together? Yes, because like illnesses can go together. Even though you and I know that when people have the flu, we would prefer to have them to have a private room, but a private room's not always available, and NCLEX is all about putting you in a bind. So I'm going to keep giving you examples where you're having to make a decision, all right? Now, let's say we had two patients that had TB. Tuberculosis. Could those two patients go together if they had the exact same type of tuberculosis? Ask your friend. If we know for a fact that they have the exact same type, because I know there are lots of different strains of tuberculosis out there, but if we know for without a doubt they had the exact same type, then yes, they could go in the room together, because like illnesses can go together. But what we always study in school is a private room, negative pressure. If the patient comes out into the hall, they have to wear a mask. The door has to be kept shut all the time, that sort of thing. Okay? But see, we may put them together if we have to. All right? Now then, here's another scenario. Let's pretend we have two patients that are HIV positive and they're in the hospital. Can they go in the same room together? Ask your friend. All right, let's think about this for a second. The first thing I want to ask you is this. What's the only reason that people that are HIV positive are ever put in the hospital? Is if they have an opportunistic infection, right? So these people are sick already, and both of these patients are immunosuppressed. So can they go in the room with each other? No, because you've got two patients that are immunosuppressed. One may have cytomegalovirus, the other may have pneumocystis. Both are immunosuppressed. Would you want to put them in the same room together? No. We always say that they have to have a private room. See, that's an example of having to be flexible with the knowledge that you've learned. What I told you was that like illnesses could go together, but I put you in a bind like NCLEX is going to do. Okay? Now then, I'm about to put you in another bind. Let's pretend we have somebody that is HIV positive in a semi-private room. So there's the patient in one bed and the other bed is empty. We've got 3 patients in the hospital that need a bed, so I'm going to force you to put somebody in the room with the HIV positive person. And now you're already saying in your mind, well, you just said they had to have a private room. I know. I'm putting you in a bind. This is what higher level thinking is all about. So I've got 3 patients for you. Who do you want to go in the room with the person that is HIV positive? The person with asthma, the person with bronchitis, or the person that is 8 hours post-appendectomy? Ask your friend. All right, what do you think? Asthma. Asthma is the answer because that is the only one that is not infectious, right? Yes. You see, bronchitis can be bacterial or viral. And then also, you would never want to put somebody with a fresh incision in the room with somebody that's HIV positive, okay? Those two things just don't go together. Now, let me give you another really good strategy to use when you are answering these types of questions, okay? When you're taking care of patients and you're making room assignments or you are giving report, follow this rule. Pretend the nurse you're giving report to or the nurse that's going to be picking up the patient load is not very bright. Now, I know that sounds silly, but you'll see what I'm talking about in just a second. Now, you see, if I were taking care, or you, if we were taking care of a patient that was HIV positive and the other patient in the room had a fresh incision, you and I know that we would use extreme hand washing and do everything that we could to prevent cross-contamination. But see, we can't be too sure about the person that's coming behind us if they would do the same thing. So another way that we protect the patient is to consider what's going to happen when you're not there. So we're assuming that the next nurse is not very bright. When you're giving report, don't assume that the next nurse understands everything you're talking about. When you're giving report, in a test question scenario we're talking about, you have to tell that person, that next nurse, the most important thing they need to know before you leave the hospital. In other words, I can't leave the hospital until I know for sure this next nurse knows to do X, whatever it is, okay? So those are some really good strategies that will help you in determining what you need to select as far as room assignments and that sort of thing. All right? Now, let me give you one more NCLEX scenario here. Let's pretend that we've got a patient, 18-month-old little girl who had the rotavirus, all right, in the hospital for the rotavirus, diarrhea, severely dehydrated, no tears, and has not wet a diaper in 5 hours. Well, that patient needs fluid, right? Yes. So they're in the hospital now, and the doctor has written an order for D5 1/2 normal saline with 20 kcl at 20 cc's per hour per pump. All right? What would you do based on the data that I've just given you? I said they had the rotavirus, diarrhea, dehydrated, no tears, and haven't wet a diaper in 5 hours. And then the order was for D5 1/2 normal saline with 20 kcl at 20 cc's per hour per pump. Based on this data, what should you be worried about? Ask your friend. Well, we've already agreed that this patient needs fluid because they are so dehydrated, obviously. But what can they not handle right now? Potassium. They cannot handle the potassium in their infusion right now. How do I know that? Because they hadn't wet a diaper in 5 hours. It is a rule that you never give anybody IV potassium unless their kidneys are working well. Okay? Now, you may be saying, well, why did the doctor write the order? I don't know, but it's my place to question orders. Anytime you get an order on NCLEX, try to look for what's wrong with that order. We're supposed to question orders, and the doctors want us to use judgment when we're implementing their orders. That could kill that baby if you started potassium because they don't have a way to excrete potassium, and then they would have a life-threatening arrhythmia. So here's what you do. You got to pick up the phone and call the doctor and say, look, I'm going to start the IV fluid and everything, but I'm not going to start any potassium on that baby until they start wetting some diapers. Okay, bye. That's what they want you to do, all right? Then when the baby starts wetting diapers, then you add the potassium to the infusion and continue to monitor their urine output, okay? All right, now let's go ahead and start looking at the GI system. And the first thing we're going to look at are some diagnostic tests. And the first test we're going to look at is an upper GI. It looks at the esophagus and stomach with dye. The patient's going to be NPO past midnight and no smoking. Now, I said no smoking for a couple of reasons. All right, you know, a lot of people think that when you're NPO that you can still smoke. That's a big no-no because smoking is going to increase stomach secretions, so the patient may aspirate. It increases stomach secretions, so we don't want that. Another reason we do not want the patient to smoke is because it increases motility. And one of the things they look at with an upper GI is the motility of the stomach. So smoking would affect the test. So no smoking because it increases stomach secretions and it also increases motility. We don't want to do anything that would alter the test. All right, now the next test we have is a barium enema, BE it is sometimes called. Clear liquids, laxatives, or enemas until clear. Well, that order scares me because can all patients tolerate laxatives or enemas until clear? No. Some people, when you are implementing that order, become very, very weak and debilitated because of all the fluid and electrolyte imbalances they're getting into. So you have to be careful with that order. They're losing lots of fluids and electrolytes, and the doctor wants us to watch the patient for that. Now, y'all, another point is this. For any lower GI test, many times they make them drink the big gallon jug of Go Lightly, don't they? Now, where do they get the name Go Lightly? I don't know, because they do not go lightly now, do they? No, they do not. All right, now let's think about that. They're going to have to drink a large volume of fluid. Usually they want them to drink about an 8-ounce glass every 10 minutes. So that's a lot of fluid, and I'm sure it doesn't taste wonderfully either. So you've got somebody who might get sick at their stomach. That's why the doctor many times will order Phenergan ahead of time in case they're starting to get nauseated. Something that will help your patient is to let it get really, really cold. Go lightly. The colder it is, the better they can tolerate it. And don't let them drink it with a straw, because if they drink it with a straw, they're going to swallow more air, which causes more GI upset. It's kind of the same principle as if you have an oncology patient, for instance, who wants a Coke. You let it sit there a minute open, let some of the fizz go out, let some of the carbonation go out so they won't be swallowing so much air when they drink that drink. All right. Now, the last thing on your handout under barium enema says, post-procedure, make sure the